It's Friday, August 19th, 2022. I was at St. Francis. I went in for my knees because I'm having a real hard time getting from standing into a seated position. Um, and it just didn't seem right. And it seemed like it was going on for longer, and they were swelling. The swelling and the pain was really what brought me in there. I'm in this. So I went in um, just to make sure that, again, like the back of my knee was hurting. My knee cracked and then it popped and then it hurt. Um, the other night because I've been walking in short circuits and then resting and then going back out, but then Epsom salt baths at night to try to reduce the swelling. Couldn't even, was having a really hard time getting into the tub because my knees won't bend in order to lower myself. So that was a problem. So I decided hospital would be the way to go, especially with the increasing swelling and pain. So I arrived at around like 4:30. Um, and whatever it was, it I didn't leave until I think they released me at 8:08 p.m. Um, while I was there was somebody that came around. He's something that's called an environmental, I have his card, environmental whatever. He's not on my paperwork for the hospital, but he had a business card. He's called an environmental services supervisor. I've never heard of that title before. Um, I thought that was very interesting. I was in something that's called a Catholic hospital. Um, I spoke to him for a little bit. He reminded me a little bit of Michelle Muhammad's um, pastor or preacher or whatever that she used to bring into the office, and how they would pray with me um, while I was working for them as an intermediary with something. So that's who this gentleman was. Reminded me of that. Um, so that was interesting. Now, while I was there, also, they ran a UA, I guess, check for UTIs. Now, what's interesting, and they did X-rays on my knees. So the doctor does not say like what he was looking for and stuff. The conversation is very whatever. More important end result was nothing. There was no fractures or anything. That was really important. And he called it tendonitis. Now he leaves. They ran a UA. Some thing called a PA comes over, physician's assistant, and she says that now I had noticed in the UA when I gave them the specimen, it had foam at the top of it, which I thought was weird and unnatural, but I don't know what it's indicative of. So I mentioned it to the nurse. But again, it's like there's all these like individual pieces that do their own job function. But like, I just, and I mean, I hate to have the same conversation with everybody because what I need to say isn't pertinent, and not each one of them necessarily wants to listen. Like when like when the doctor came over, that was speaking on the knee area, I said to him, I said, just so you're aware, so I give you a whole picture. I had just come in. They gave me a blood. I had to be rushed in for a blood transfusion, an iron. I had an iron deficiency. I was like, but month previous to that, I had to have a biopsy done because some skin change. I was like, and I needed an antibiotic. I was like, so they ran a UA. I was like, and I'm waiting for those results. He said he'd look them over and let me know, but he didn't. It was the PA who came over who then offered me antibiotics, which I took. But now I'm reading the results and it's on the Epic system. Um, it says there's leukocyte esterase, there's traces of ketones, there's a reading of something called a urobilinogen. They performed a microscopic, and there's other things on here. What I don't understand is I'm in the hospital. I asked for like, should I speak to, or should I be seen by their nephrologist, renal specialist, whatever, while I'm here, considering there's all these like little minute pieces that I just want to make sure that there's not something larger. I said my left hip is hurting. I don't know if it's anemia related or not. And then as I come home and I read the results myself, it mentions possibility of like a hepatitis. I mean, but again, it's like I'm 44. I should not be feeling this way. I should not have this chronic carry forward problem. My body should be able to rectify itself and find balance in homeostasis. And what am I doing wrong? How do I rectify this myself? I can't even get that answer from a doctor. That's what's so frustrating. They have all these medical degrees, they have these positions, they're there, but and they have this like standard cookie cutter answer for the one problem you came in for. But I'm even sitting there and I'm like, I want to make sure, should I need to have this checked out and how it integrates into one another. So this way I'm better prepared at, I mean, I'm trying to be an active participant, but it's like, he's like, I really, when I spoke to the doctor who's telling me about the x-rays from the knees and that it was tendonitis, he's like, I really don't see how it's related. He says, I don't really see how it's relatable. And I'm like, all right. I mean, like, what am I supposed to do? Then they come over, the nurse comes over with Tylenol and Lanocaine patches. One, I don't really need Lanocaine patches. For me, it's like placebo patches, unless they've got some kind of miracle salts in them. I don't even know what's in them, but I don't really need them or want them. And the same thing with the Tylenol. I'm like, shouldn't I be getting an anti-inflammatory? He just said I needed anti-inflammatory. Why are you giving me Tylenol? She's like, for the pain. I'm like, first of all, Tylenol's not going to touch the pain. Let's just be honest. I was like, but second of all, I need an ibuprofen as an anti-inflammatory. But then, of course, the indicators being some of the things that are in here, I'm worried about taking anti-inflammatories if I have something going on with my liver. But again, nobody mentions the liver, nobody mentions the kidneys, but I can see my coloring is off. I have the results now on the paper that are showing something's going on. But I'm in a hospital. And I said this to Lewis when I came home. He's like, tell me what happened. So I told him what happened. He's like, I really don't like how this healthcare system is just failing you. And I'm like, well, exactly. He's going into its mind and body. I'm like, yeah. I'm like, listen, Lewis, it's partially that. I was like, but it's also partially that there's some systemic continuous thing that's not being cured. It's not even being spoken about. It's not being given a name. It's not being addressed. And it seems like all of these little things are popping up like red flares. And I don't know who to speak to about it. I mean, like the primary care doctor, I mean, it's so frustrating because the idea of a primary, in theory, works extremely well in like building a healthcare system by boxes and what they're supposed to do and writing mission statements and whatever the heck else the people that make way too much money do in life. But then there's the patient who just gets thrown through the cracks. I'm listening and watching some of the other patients in there. One guy was there with his mom. He was saying that he went in for a procedure. The doctor wound up charging his insurance $1,700. He's like, it should have been like $150, but the doctor charged $1,700. He's like, and they even said to his mom, he's like, what am I gonna do? Fight with him about the bill? I mean, the insurance wound up paying for it, but it's just, and it's absurd. And then they were going back and forth. Apparently, he had some surgery he found out later he didn't need, and something happened with her. And I'm just like, the pendulum swings so far in both directions. There's so much medical waste and overbilling and whatnot, but then there's over proceduring. Like, they want me to now go follow up and see an orthopedic. I'm like, orthopedic, it has surgery next to it. I don't want medication for it. I don't want surgery for it. I want to know how that one building block in my larger body systems of physiology, how it's breaking. And why does not one doctor look at these test results and cross-reference them to rectify the main underlying symptomatic issue and problem? I mean, I don't even have the words for it at this point. So then I'm lost. I just don't know. I mean, I've gone down somehow. I got up in like the 200s. Now today I'm down to 196. I mean, it's the exercise and it's the diet or the shakes back to bringing my weight back into control. But even the protein shakes are at a like isolated, so my blood sugar's not all over the place theoretically. Um and it's consistent in whatever. My weight's going down, which is a good thing. But I'm just, the fact that I'm so rigid, like it almost feels like a stiffness in my joints, certain joints, not all of my joints, um, and like a tightening of the muscles to overcompensate, almost like in a microgravity kind of a way. At times, my legs feel extremely heavy. I mean, again, I know there's an infectious disease doctor somewhere that's a specialist that specializes in these things. But when you come to a hospital and there's records on file and you see these doctors, like, I mean, I don't know who they're there for. And then they want to shove you off to these specialists that have, and then you spend your whole time shuffling from one specialist to the next, but nobody care coordinates. It's not like they have a medical group or a medical partnership that is good for the patient. It seems like they have these medical groups to only protect the doctors and the doctors' schedules so they can have a life. But I don't see like coordinated team of doctors. Like, I don't see a renal specialist paired with a joint specialist for like any kind of joint swelling. I don't see a care coordinator put in there. I don't see patient, like, I'm as a patient, I'm not being assigned like a main go-to that then, I mean, coordinates. It's just, it's really frustrating. It's really frustrating at the level of care or the lack of. And then I see how, like, tonight, there was a transport team involved. I saw hallways of whatever, of staffing that's inside the hospital, and I'm thinking hospital staffing contracts. And then I'm like, how the hell did they get these contracts? And then that goes back to what I see on the television with, and the buses from like Abbott down in Texas to Adams in New York. And now these people are here and they have children or they're going to have children and they're planning all of their futures. And I see them getting these hospital contracts. And I'm like, where where did like that version, I'm not clear on where all this bussing in of stuff came from and how all of these contracts were handed out in ways that are now making the healthcare system really inefficient and not work. And I don't know if the doctors that I needed left the state because the state's hospital system is being, I mean, this is Catholic health, but I don't even know how state is even involved in this. Is it the state? Is it the federal? Is it the church? I mean, like, is it Cardinal Dolan's responsibility? Does somebody need to report to him? Does anybody even know? Like, I mean, I don't know. It's just, I feel lost. I'm 44. I should be healthy. I should be able to work. I should be able to have work. I mean, I was born for a special purpose. I have an immaculate conception. I mean, it's just, it's so frustrating. I don't know why. I feel trapped here. I really feel trapped inside New York with no access to money, job, future, or some helpful civic interaction or engagement. I don't even know. I mean, it's so frustrating. And then I'm like, I think the tenant that moved in upstairs from Madrid, and then he moved here, and then all of a sudden his daughter got into the Air Force, and he was in the Navy. And I'm like, why don't I even know how to get into the Navy? Why in my life frame has nobody even talked about Army, Navy, Air Force? Like, there's been no, like, I mean, it's, again, it worries me that it's a greater existential system of breakdown or forcibly derailing my person for some reason in order to replace my person with something else, because that's what I see that knows about military services or knows about veteran services is everything I'm not. And I'm like, now why was I passed over and they were allowed entry into this honorable position and in this position of intelligence and in some kind of network of the know? Why was I passed over and cast aside? And why can't I even, I mean, and now I just feel like I'm being buried underneath whatever it is that they did. I mean, I saw today on the news there was some solicited effort made that Mayor Eric Adams' face was there, and then next to it was some kind of solicited effort in 1999 to raise money with DHS involved for some future whatever. And I'm thinking to myself, so they knew? I mean, it doesn't make it more acceptable now that it's happening. But how could they have planned for this and allowed such a thing? It's star 1978, star 8378, Nicole, Cattaruzza, it's Earth, Solar System, Milky Way Universe, Galaxy is broken, and it's Bayside Station, Bayside, New York, 11361.